We often hear that in America, healthcare is broken. Can you help us understand? We don't work in healthcare at
Yeah.
all. And so, can you help us understand why people say that? And if you can speak to if you agree with that or if maybe that's an overstated point.
I would say there would be three elements that I think how people experience healthcare. And I'll point to each one to your question of whether it's broken or not. One is quality. The second is cost, and the third is the actual experience of the patients or the consumers who try and go and procure healthcare, right? On the first, quality, I actually don't think it's broken. Mm-hmm. I think of course there are places that we can improve, and if you live in lower income zip codes, you have a worse quality outcomes than people who have means, and so we constantly have to push on that, But overall, if you compare America to other industrialized nations and the outcomes that we get, they are by far the best. And frankly, the innovations that this country creates are amazing. Like, look to the fact that, GLP-1s, these drugs like Ozempic and Wegovy now actually can really ameliorate obesity if you take them. I mean, It's just incredible, right? Yeah. In terms of the impact that can have in human health, because obesity has so many other comorbidities. And now you see these drugs like lowering your risk for heart failure, like improving kidney disease. Actually, I just read a study where it might lessen or lower your likelihood to have Alzheimer's.
Wow.
Yeah, so outcomes in our country are awesome. It is not broken. It is actually an amazing system. Now, the other two, cost, it is broken. Healthcare is like the gift that keeps on giving to businesses in some ways, right? Because it grows GDP plus 4%. On a good year. Sometimes it grows GDP plus 7%, wow. Right? And it is, 20% and growing of our economy. It is the single line item in every single state's budget and balance sheet that will bankrupt every single state because they pay for most of Medicaid. So it's the largest unfunded liability, right? It is the reason, as we talked about, that a lot of people go bankrupt. I mean, you could go on and on and on. And in terms of cost, our performance is way worse than a lot of other industrialized countries. So that sort of equation of quality versus cost, we got to work on the cost because it's unaffordable and it's existential in terms of what it will do to the American economy. So I'd say it's broken there. And then the patient experience, it has gotten better since when I first started investing in healthcare, for sure, but it is so far removed from any other experience you have in the modern economy, right? And I always say to my partners at Bessemer, like, healthcare is like 10 or 20 years behind every other industry that we invest in. Like you could hail a taxi via Uber, right, or a black car via Uber way before you could actually like book an online appointment in healthcare, years before, right? And even when you book an online appointment in healthcare, it's still like not a great experience.
Is that because of the regulatory guardrails with healthcare?
Well, honestly, one of the things, hearkening back to the formative piece of legislation that we talked about and how important government is to healthcare, only in 2008, actually coming out of the last economic downturn, when the Great Recession, when all the banks almost went under. One of the things that was in the Recovery Act, the Stimulus Act, to reboost the economy at that time was this piece of legislation called the High Tech Act, which basically was $40 billion. It's actually a large amount, but not that large amount in our economy, that the government used to incent doctors and health systems to actually move your medical records from being on pen and paper. You guys might be too young to remember this, but literally when I used to walk in my doctor's office, there'd be stacks of filing folders and cabinets with, Steve Kraus, Kraus, and all my records would be in there. That all got digitized. But that only happened because the federal government said, hey, we're going to pay you doctors to do this because we know we have to do this in order to get the data into zeros and ones like every other piece of the economy. And once you get the data into zeros and ones, you can actually start to do stuff with the data. So that was like 15 years ago that happened, to give you a sense. Like, think about when Salesforce and Oracle and all those companies were created, like decades before, to my point earlier, than when we actually had true digital data in healthcare.
I guess they really are 10, 20 years behind.
10 or 20 years behind,
industry,
always.
Yeah.
And so only when you have that can you start to do stuff with that data, right? Can you start to think about, okay, how do we stratify the population? How do we reach out to the people who are sick in a digital way? Then you start to see telehealth, right? Because only once you start to have the data can you really actually have virtual care, right? Otherwise, everything has to be done in person. So I think you have to set that, give that context to understand where we are. But we made lots of strides. By the way, virtual care was like non-existent pre-pandemic. We had made a number of investments early on before that, thinking that it was going to happen. But the pandemic, because no one could go see their doctor in person, I say advanced our industry in terms of the sort of digital and virtual delivery, like 2 decades in the matter of, a year, right? So that was unfortunately, that was a horrific, episode in American history. But from the healthcare perspective, it actually forced, again, a reason to force doctors and health systems to actually consider how they deliver care. It doesn't all have to be in person. And now I'd say the most exciting thing is I actually think AI, which hopefully we get to talk about, is it's the first time I've ever seen our industry where we're not 10 or 20 years behind. It's the first time we've actually seen healthcare be current with other industries. And there's lots of reasons for that we could talk about. But that's actually really exciting because now I actually feel like, wow, the industry I invest in is kind of equivalent to other industries in how it's adopting technology.
Tell us about that. Can you give us maybe a startup you've invested in recently that you're really excited about that's optimizing AI in the healthcare space?
Yeah, I can talk about a bunch. Actually, sometimes, like we talked about earlier on, one of the things in venture, it's good to be early in spaces and good to be non-consensus. And about 6 years ago, my partner in Israel, Adam Fisher, and I both started to see these really interesting entrepreneurs who were using, this was pre-ChatGPT and some of the new LLMs, but this was like, using AI, like earlier generations AI, using machine learning, using computer vision, and applying it to healthcare. And so we created a little seed fund within Bessemer. We called it the Deep Health Seed Fund, and set aside it was within our core fund, but we set aside some money to invest in these companies, and we made a bunch of seed investments in companies. So example of one, and a lot of those have done well, by the way. Again, good to be early and good to be non-consensus. Now investing in AI is completely consensus. And even in healthcare, it's consensus.
That's every conversation we have had this week,
Right. So that's a key learning in my career. But anyways, one company I'll talk about that we invested in, actually, it was one of my last meetings I took before the pandemic. So wow, glad. Actually, 2 of my AI companies. My last 2 meetings were 2 AI companies. That I was in. But one of them, and I can tell you about both. One of them's called Abridge. Abridge is people probably have read about it. It's probably one of the, regardless of being healthcare, it's probably one of the top AI companies out there. What Abridge does very simply is all of us are familiar with walking in the doctor's office and you want to talk to the doctor about your complaint that you have or your shoulder hurts, and they're not looking at you because they're sort of back might be turned to you. You might be they're typing into the electronic medical record that we talked about, and they have to do that because that's the system they have to capture the clinical note. And then the reason they capture clinical note is not just to make sure that your care it's documented, but also that's the way they get paid.
Gotcha.
Doctors spend a lot of time doing this in the office, and it doesn't lead to a great patient experience. But even worse, actually, they spend a lot of time outside of the office, like nights and weekends. Thing they call pajama time. They literally call it pajama time because they're actually documenting your visit and making sure they got it right when they're in their pajamas. So it takes
That's
away.
so far from whenever they met the patient, though.
Right. And it's also not great for their lifestyle, right? Yeah. So anyways, one way that systems before AI dealt with this is a lot of systems would hire clinical scribes, human scribes. So you'd actually have maybe someone in the office or maybe someone in India who was listening in to your conversation, so the doctor didn't have to be so meticulous in typing and could pay more attention to you, and also didn't have to do it outside of the office. Anyways, what does Abridge do? Abridge takes AI, and you just have your cell phone, and a doctor has a recording device, whatever it may be, in the office. It's recording the conversation, and it automatically generates the note. Fills all of both the sort of numerical drop-down menus that they need to fill. Also, makes sure they get the note right in the qualitative form. And by the way, once they're doing the note, it'll show the doctor, oh, this person's complaining of like left shoulder pain. Have you thought about X, Y, or Z? Right? So they can then take the data that it's capturing and provide clinical decision support. It can then automatically link that data, whether it be qualitative or quantitative, that they captured to actual coding, right? Because once you have the data, again, in digital form, once you transcribed it, there's so many things that you can do about it. So there's not only just capturing the note, but then all the downstream things that you can do, both to improve care, as well as ultimately to help the doctor get paid. It's a very compelling piece of technology. And as a result, the company's done really exceptionally well, both commercially and in raising capital.
That's amazing. You mentioned that like it takes 10 to 20 years sometimes for healthcare to catch up. And it sounds like a big part of that is the adoption of doctors or medical professionals of just adopting the new tech. So even if this tech does come out, how do you kind of bridge the gap to so that doctors, medical professionals are willing to adopt this new tech, even though it might be so much better, but I would think that adoption process is kind of the hardest part.
Yeah, it's a really good question, and for sure there are more barriers to. I always say in healthcare, it's not just about making the sale. It's then, to your point, about the implementation and getting by, all of the HIPAA regulations and the compliance and the security. That's legitimate. That still exists with AI. The thing that I'd say about AI versus traditional software, it provided utility, but the doctors or whoever the end user had to actually do work to do it, right? Like you had to learn the system. You actually had to, whether it was actually embedded in the EMR mattered a lot, because if it wasn't embedded in the EMR, then you literally had to open a different, web browser, which sounds so minimalistic to people like us who might be at your desk and you might open IE instead of Chrome or whatever. But for a doctor, a doctor is like, they're just running around trying to see patients and triage all day. To have to open up a different web browser 100 times in a day, like that's actually a huge barrier, right? Definitely. You probably have to have another single sign-on, right? I mean, there's a whole, it sounds like small stuff, but it's real. But what does AI do? It takes away all that work. Like, think about what I just talked about with the bridge, right? Before the doctor had to type, maybe they had to hire a scribe. Like, these were things that doctors had to do to use the software. Now a bridge is like, just get out of the way. Just, literally, just wear something on you or use your cell phone, have a recording device, and we'll do the rest.
Yeah.
So all of the human training and effort that you talked about, which is real in terms of implementation and then once you implement, actually getting doctors to engage, that's all the other thing. Like healthcare software had very low engagement rates generally.
Interesting.
Now that goes away because it's all automated. That's what the promise of AI is, and that's why I think this time is different than all the other times where we were always a lot slower to adopt.
Yeah,
that makes a lot of sense.
I think you said the three biggest issues were quality, cost, and experience. But I think cost is probably the biggest pain point for Americans, in the healthcare system. Is AI or can AI help with that problem for people who are seeking medical care?
I think it can. Ultimately on the clinical side, where, by the way, I think the hurdle to adopt AI is higher. We can come to that because there's really several different places where AI can be applied. But actually where I think the cost impact will be felt first is actually all in the back office, the stuff that patients don't see. I'll share an amazing stat to you guys. Do you know how many administrators, think every year the healthcare system will add one doctor. Do you know how many administrators they'll add per one doctor? Take a guess.
3.
I was going to say 4.
10.
Oh my goodness.
10 administrators
Why
for
they
every
10
one
people
doctor.
for one doctor?
There's a lot of, charting work and regulation
yeah.
and all this stuff. So every one doctor we add 10 administrators in healthcare.
Wow.
A lot of it's meant for, there's a lot of patient eligibility checking at the front end, calling patients to make sure they're prepared for a procedure, doing a lot of testing about whether they're right. Then you get to the doctor's office. Frankly, the clinical care area is pretty efficient, but then you got to do all this whole revenue cycle process to get paid, which is loads and loads of human being. So that's where I think AI can actually make a huge impact, and we're seeing it, is like literally stripping out some of that that administrative cost. And by the way, like 60% of doctors and nurses say they're going to get out of the profession in the next 5 years, and the number one reason they cite is because of administrative burden. So not only are we hiring a lot of people to actually try and help them, but then to the pajama time point we just made, the doctors are also themselves getting burnt out because of this administrative burden. And so it's like this double whammy. So I think that's where, if you take out half of it, right? I mean, that's a significant load of cost that the patients won't actually see, but it'll be happening in the back office.
Yeah, my girlfriend's a nurse, and she just quit a couple days ago because of how stressful and strenuous like the work is, and pajama time is so real for her and all the other doctors at the IVF clinic. Like they have to go home and just do work until like 11 o'clock at night, wake up, go to work at 7, and then 7 to 11 every day is like their schedule. And so it just seems like that AI needs to be implemented quickly to be able to, and efficiently to be able to get these people not to work just grueling jobs like all day, every day, because they have lives outside of just.
And I'm sure it
healthcare,
also
yeah.
would hurt their kind of ability to be a good nurse or doctor or whatever it is. And like you said, like you're going to retain more healthcare workers who aren't being burnt out so fast by just taking away the
100%.
the
They don't
tasks.
want to do all this administrative stuff. The reason they got into the profession is because they want to care for patients.
Yeah.
And when that ratio gets upside down, they can go do other things, right? They're talented people. So I think that's right.